big question I always have, or questions asked at me, is when do we use a hot compress, when do we use a cold compress, when do we use ice, when do we use a heat patch, is it muscle, is it bone? So Tim, you're the best person to ask. So when do we do this? What can I advise my patients about when to use temperatures?
Well, it's funny you should ask me because I actually did part of my master's on this very topic.
Okay.
And I have to tell you, I looked through dozens of research papers and there's no consensus about whether you should use ice or whether you should use heat and how long you should use ice and how many times a day you should use ice. And virtually every single research paper doesn't specify the length of time or the frequency that they use ice or heat. And the ones that do completely change depending on the research. So there very much is no rule on how long or what to use. But I'll give you a general rule of thumb that I use.
Great.
If it's an acute, fresh, very painful injury and it's in the acute early stages, the first few days, we probably steer towards an ice pack.
Yep.
Now why? Now, there is some argument that sometimes we actually want the inflammation. And yes, we do want the inflammation because inflammation is actually a good thing. But sometimes the body can create an overreaction of inflammation. So we want to control the inflammation. And also by reducing some inflammation, we can also reduce pain. And ice can help reduce the pain as well as the inflammation. So it can help numb the area. And that can be really, really useful. So I do tend to recommend ice in the early stages. And I tend to favour more towards heat in the more chronic stages. Now, my personal feeling is one of the most effective things you can do is a mixture of ice and heat.
Oh, that's good. Yeah.
Now, why does this work? Well, what the ice does is it causes the vasoconstriction. So the vessels tend to narrow, which means there should be less sort of blood going to the area while you've got the cold on. Now, what the heat does is the heat tends to cause this vasodilatation, this widening of blood vessels. So when you use the ice, it can narrow or constrict the vessels, which can restrict a little bit of blood flow, and then the heat can vasodilate and flush the area of blood. Okay. So the combination, the therapy between ice and heat can help circulate the blood. So it can help push the fluid through to help move the blood along, because especially in an ankle or a joint at the end of a limb, sometimes the swelling is hard to get rid of. So we want to you get rid of the fluid. So we can use ice and heat. Ice and heat's a really good combination. Now, when do we use heat? Well, heat, I think, is really good for arthritic problems. And there's a reason why older people like warm weather. Because warm weather tends to make your joints feel a bit easier.
Yeah.
And a hot water bottle does the same thing, like a hot bath. If you've got muscle pain, sitting in a hot bath feels really good. Yeah. Because it helps ease the pain, and also it makes your joints feel more mobile. When a joint is warm, it tends to be more mobile. Yeah. When a joint is cold, it tends to be a bit stiffer. So when you go to a warmer climate or you use a hot water bottle, it helps with the joint movement and mobility, which is why we warm up for sport, right? To get the joints moving. Now, it's the same for arthritis. If you've got arthritis, whether it's your neck, your wrist, your back, those joints tend to be a bit stiff. So we want to get the movement, and the heat can help with the movement.
Lovely.
So for chronic conditions, heat can be really, really good. And if you're not sure, try them both.
Perfect. What a great way to summarise. Thank you so much, Ray.